day, everyone. Today topic cholinergic agonists. Efferent nervous carry impulses from the central nervous system to the peripheral organs. Efferent nerves divided into somatic and autonomic nerves. Somatic nerves innervate skeletal muscle and dependent consciousness. Autonomic nerves innervate smooth muscle, heart, and glands, and don't depend on consciousness. Autonomic nervous system divided into parasympathetic and sympathetic division, which have opposite effects. Parasympathetic system, the main neurotransmitter is acetylcholine, is used usually religion, and sympathetic nervous system neurotransmitter is non-epinephrine, and but acetylcholine is usually sweet glands, and dopamine is released renal vessels. Cholinergic agonists are activate or stimulate cholinergic receptors. Cholinergic receptors are divided into muscarinic and nicotinic receptors. Muscarinic and nicotinic receptors. Muscarinic receptors located and smooth muscle and heart and glands. Nicotinic receptors are located ganglia, adrenal medulla, and neuromuscular junctions. Cholinergic drugs activate cholinergic receptors and classified according to their action. These receptors, cholinergic agonists that acting muscarinic receptors, these muscarinic agonists, cholinergic agonists that acting nicotinic receptors is nicotinic agonists. Nicotine and is drugs that acting and muscarinic receptors and nicotinic receptors is that MN cholinomimetics. MN cholinomimetics or agonists muscarinic and nicotinic cholinereceptors. These drugs are classified directly acting and indirectly acting. Directly acting MN cholinomimetics bind M cholinereceptors, N cholinereceptors with acetylcholine esterase. These drugs are mainly used in ophthalmology MN-cholinomimetics include carbocholine and acetylcholine. Carbocholine is used in glaucoma as eye drops. Disadvantage acetylcholine is very short duration of the action because it is rapidly destroyed by acetylcholinesterase, so it is used rarely after extraction of cataract. Indirectly acting MN-cholinomimetics inhibit acetylcholinesterase, thereby increased amount of acetylcholine in cholinergic synapses. Effects anticholinesterase inhibitors include effects mediated muscarinic receptors and effects mediated via nicotinic receptors. Irreversible MN-cholinomimetics form covalent irreversible bind with acetylcholinesterase and activate them. This drug are organophosphates. Organophosphates are very toxic substance, so it is used only topically. For example, ecotiophate as eye drops in glaucoma. On the other hand, organophosphate widely used as insecticide and as military gases, zorin, zoman. Mutation MN-cholinomimetics. Phytostigmine and ecotiophate are used in ophthalmology, in glaucoma as eye drops. Neostigmine and pyridostigmine are used in myasthenia gravis. These diseases characterized progressive muscle weakness. These drugs are used for the treatment myasthenia gravis as tablet orally and intravenously in acute myasthenic crisis. Edrafonium is used for the diagnosis myasthenia gravis. Donepezil, galantamine, and rivastigmine are used in Alzheimer's diseases. This drug increased amount acetylcholine in cholinergic synapses with increased transmission in the cholinergic synapses. So this drug increased intellectual function central nervous system. During overdose and cholinomimetics, possible poisoning and cholinomimetics. The symptoms poison and cholinomimetics include bradycardia, constriction bronchiale and dyspnea, diarrhea, salivation, pupil constriction, and diarrhea, dyspnea, and also poisoning organophosphate. Organophosphate is used only topically. Ecotiophat as eye drops in glaucoma, and on the other hand, organophosphate widely used as insecticide and as military gases. So these drugs possible poisoning, possible poisoning symptoms by organophosphate, slurred speech, confusion, paralysis, twitching, and nausea, vomiting, and dyspnea, bronchial constriction, and coma. Treatment poisoning by organophosphate, also poisoning by cholinomimetics, the same is used. Antagonists muscarinic receptors, atropine sulfats intravenously, and reactivators anticholinesterase inhibitors, pralidoxin intravenously. I am finished. Muscarinic agonists or cholinomimetics drugs. Muscarinic agonists activate cholinereceptors. These drugs effects are similar effects of the parasympathetic nervous system. Let's list them. Increase of salivation and increase secretion, sweat glands, and bronchial and gastric glands. Increase of constriction, smooth muscle in the gastrointestinal tract and genitourinary tracts and bronchi. Decrease heart rate and slowing atrioventricular conduction. Vasodilation releases endothelial nitrogen oxide, and ocular effects include the constriction of the pupil and decrease intraocular pressure and spasm accommodation. Ocular effects, muscarinic agonists are mediated via muscarinic receptors located in the iris sphincter and ciliar muscle. Activation muscarinic receptors in the iris sphincter, leading conduction iris sphincter and constriction pupil. Due to the conduction iris sphincter, the iris is pulled away from the angle of the anterior chamber of the eye, and the trabecular meshwork is opened, and outflow ocular fluid through the Schlemmer's canal is facilitated, leading decrease intraocular pressure. In the other hand, activation muscarinic receptors ciliar muscle causes contraction this muscle and decrease contraction suspensory ligaments, and limbs become to be more spherical, and the vision, the focus of vision is fixed on the nearest objects. Application muscarinic agonists. Muscarinic agonists are used mainly in ophthalmology. For example, pilocarpine. Pilocarpine is used as eye drops and eye ointment. Pilocarpine is used in glaucoma. Muscarinic agonists are used in also used atony, gastrointestinal and genitourinary tracts, when decrease smooth muscle, decrease contractile function, smooth muscle, and that leading fecal and urinary retention after an operation. For example, betanihol in tablet orally and subcutaneously in injection solution. Also muscarinic agonists used in dry mouth associated Sjogren's syndrome. For example, cevimeline. Cevimeline is used in capsules. Nicotinic agonists or N-cholinomimetics. Nicotinic agonists are causes effects, excitatory effect on the central nervous system due to the increased transmission through the cholinergic synapses. Vasoconstriction, increase of heart rate and arterial blood pressure, increase of secretion epinephrine, and increase transmission in the sympathetic synapses, increase secretion of the exocrine ganglia, and increase smooth muscle in gastrointestinal tract, genitourinary tract, urinary tract. Nicotinic agonists is used. Nicotinic agonists are used for treatment nicotine dependence. The long-term causes psychological dependence. The symptoms nicotinic dependence include irritability and depressed mood, anxiety. Sometimes physiological dependence can develop. Rapid withdrawal induce some somatic symptoms like tremor, increased appetite, and cognitive disturbances. Nicotinic agonists are used for treatment nicotinic dependence. Nicotinic as tablet, chewing gums, and transdermal patches. These drugs relieve symptoms, withdrawal nicotine. These drugs include lobelimia, nicotine, and varenicline. Varenicline is a partial agonist nicotinic receptors. Nowadays, varenicline considered to be most effective drug against smoking. For example, Nicorette tablet, Tabex in tablet, and other.